Hey there, it's me, Tony. I'm out in front of Maryland Hall. And again, like I said, we're on this journey to find answers for you, the prospective nursing student. This is kind of where everything goes on here, and we're going to go in and try to find the Dean of Nursing and Allied Health, Laura Preston. Okay, like I said, we're at the office of Dean Laura Preston, and we're just going to barge in here and see what she has to say.
Hi, Tony.
We're here to try to find answers for prospective nursing students about your program. And being that you are the Dean of Nursing and Allied Health, I wanted to ask you some questions. You busy?
No, I'm so glad you're here, and I'm really glad that people are interested in nursing. That's very exciting. That the demand for nursing is only increasing. There's, as healthcare becomes more complex, as the population ages, as nurses are retiring, there's just a greater need than ever for nurses. And so we have really been asked by Maryland as well as nationally to increase the number of nurses.
Okay, terrific. So there's quite a demand. I've heard this idea that nursing is a calling, not just about a paycheck, things like that. Can you shed some light on that for our students?
Well, there are people that think nursing is a calling, and I think it's an interesting discussion, and a lot of people would agree with it, especially nurses who have been in the profession. Some may disagree with it, but what is really true for sure is that it takes a special individual to be a nurse. It is a very demanding, challenging profession. While extremely rewarding, I can't think of any profession, anything that I would enjoy more than nursing. It's a challenge, and I would say some of the reasons that make it that way is that nurses are oftentimes at the bedside when people are at their worst. Mm-hmm. So that in itself places a lot of demand on the nurse. Also, nurses, when they're working, they can't walk out and take a break. You can't leave and go for a walk and relax and calm down. Sometimes nurses have a hard time just getting to lunch.
Right.
So it takes a certain commitment, and it takes something beyond thinking that you're getting a good job. A lot of people think that nursing is great because you're always going to have a job, you can always work. I would challenge that. I mean, that's maybe true, but that's probably not the best reason to pick nursing. Being committed and really wanting to work with people would be a better reason.
Okay, Dean Preston, you've made the point that nurses need to be committed and that they have to want to work with people. Can you explain that a little bit more?
Well, I would say that that's the first critical piece that a person interested in nursing has to think about. Are they committed to working with people? Do they want to work and improve someone's condition? Mm-hmm. So that's what nurses do. But nurses, in order to be a nurse, they need to be smart, mm-hmm. academically good thinkers. Nursing requires a very competent thinker, a person who can make decisions, make judgments based on data, based on their assessments. They need to be good problem solvers. They need to be really strong communicators. They need to be good communicators with the patient, with their team members, other nurses, other people on the healthcare team, physicians, nutritionists, physical therapy, pharmacists. All those people are part of the team that nurses need to communicate with. So that's important, that they are that they have good cognitive skills. That's one of the reasons why the process for selection is so is critical. Nurses need to be good at science. They need to have math skills. That's important. Nurses, another thing that is important is that when people are thinking about the profession is to consider if they're calm and good in difficult and emergency situations. So those are the kind of things that a person thinking about nursing needs to consider. The other thing about nursing and nursing education is that in addition to that cognitive piece, we work on the psychomotor piece, skills, and we work on the affective piece, how to be professional, how to demonstrate and show caring, how to develop values that are consistent with ethical care delivery. But in terms of something I want to do, if you have time, I'll show you our skills lab, and you can see how we teach some of the psychomotor skills.
Let's take a look at the important stuff. The first thing that Laura mentioned is that nursing takes a special kind of person. Also, it's rewarding, but it's quite a challenge. It's not your typical 9 to 5. Keep in mind that nurses have to be at their best at the bedside when people are at their worst. And the last thing, it's not just about having a good job and stability. Again, it takes a special kind of person.
This is that psychomotor piece that I was talking to you about. So nurses need that cognitive piece, the theoretical piece, but they need some psychomotor skills. And so basically before nursing students do anything at the bedside, they're going to come to the lab, and we have several of them. So basically this lab right now is set up for IV skills. So you can see we have a simulator here. Students can actually run an IV. They can look up the medications. They can do all the things they need to do. Over here is just a place where they've been practicing injections. And so they start off just using a pillow, drawing up the medication, using a pillow, and then they'll use a more anatomically correct model for injections. But there's several stages. Again, I just want to convey that it's a profession and it's an education that does have a practice piece. So there's some psychomotor skills, and this is the area that they come to learn at. This lab is a more high fidelity lab, and we have adult human simulators, and then this is one of our babies. So basically on the mirror on the other side, someone is actually operating this baby and can control its vital signs, its heart sounds. So students really get very lifelike opportunities to give care. So this baby is very close simulation to a real baby in terms of its vital signs and some of its functionings. It'll cry, it'll need comforting, the kinds of things that a real baby would need. Of course, it's not a real baby, and
the rubber skin kind of gives it away.
Yeah, it gives it away. But it's a good way to get students ready to work in a real setting, in a hospital setting.
I can't thank you enough for letting us come in here.
Oh, I'm so glad to do it. Hey, I've got an idea. It seems like you were impressed with the lab, right?
Absolutely. It was very, very cool.
Well, I think it's one of the coolest parts of nursing education. So I think what you should do is come back when classes are in session. I'm sure they wouldn't mind if you took some pictures of them while they're working in the lab. They might even have some things to tell you that I didn't think of.
Awesome.